Something like, wow, painful, get up. Okay, oh my god. Oh my goodness. Okay, let's see how you walk, okay? So I'm gonna put it here. So when you walk like really slow, like painful.
Yeah, and this foot, it got to be slanted out.
It's like,
if I turn it in,
it's painful. You feel a little bad.
Feel pain.
So wow, you like even when you walk, you feel pain. On the right side, right hip.
Yeah.
Okay.
Exactly, yeah.
Okay, good.
I feel the pain here when I'm raising.
Okay.
Right here.
I see.
Right here.
Okay.
And then a little bit in here.
Oh, okay. And then, so tell me what happened to you. Okay, tell me what happened.
Yeah. Well.
So when I lower pain.
Here, like right here, and
right
then when I stand up, I feel the sharp pain like somewhere in here. Like I guess when the bone
is it in the front or at the back? In the front?
In the front.
In the front? Oh.
And then when I'm standing for a long time, it starts in the back.
It's the back.
And that's when I know that I have to sit down.
Oh, so you say you cannot even raise your leg? So is it difficult to raise your leg?
Well, when I'm sitting down, it's not a problem. When I'm standing is when it's a problem.
Okay, how about stand up now? So I want to see like how you stand up. Stand is painful.
See, like right now when I stand up, the sharp pain is back here. Yeah.
So when stand up, shopping is right here, right? Is it in the front or at the back?
In the front when I stand up.
Like how come you touch it at the back side?
Here.
Here or here?
Here.
Okay.
Yeah.
Here. Oh. Okay. Does it go all the way down to your feet or just local?
Just stays like up to here.
Stay up to here.
Just here.
Just here. So only when you stand up is painful.
Yeah.
When you sit down it's okay.
When I sit down, it's painful here in front.
Oh, in front.
And when I raise my leg, this is like when I'm raising it.
Oh, barely you can raise it.
Let's see, I feel the pain here when I'm raising.
Okay.
Right here.
I see.
Right here.
Okay.
And then a little bit in here.
Oh, okay. Okay, can you sit down now? Is it painful? Is it painful?
I gotta sit down, it's fine.
Oh my goodness, wow.
Pain, yeah.
Okay, so like how long ago? Like a couple weeks ago?
6 days ago.
6 days ago? Only 6 days? What happened? Like you say you lift something heavy?
I was ducking and just
like clean up.
Clean. And I guess I didn't use my knees, I just bent down.
Oh, okay.
But I don't know, I feel like safer if we would do an x-ray to see if there's anything.
Yeah, of course. Yeah, okay. So what's the pain level? 4, 5, 5, 6? 10 out of 10? 10?
It's a 10.
Oh my god,
yes.
10?
Yeah, and when I wake up in the morning to get out of bed,
painful?
Painful. Yeah.
Oh wow. Okay. So it's 10 out of 10. Okay, good. So okay. Oh, perfect. Yes, thank you. Okay. So in here and then okay. Okay. So can you put your email here? Okay. Do my quick. Something like wow, painful. Get up. Okay. Oh my god. Oh my goodness. Okay, let's see how you walk, okay? So I'm gonna put it here. So when you walk like really slow, like painful.
Yeah, and this foot, it got to be slanted out.
It's like
if I turn it in,
it's painful. You feel a little bad.
Feel pain.
So wow, you like even when you walk, you feel pain. On the right side, right hip.
Yeah.
Okay.
Exactly.
Okay, good. Okay. Yeah, I'm gonna take full spine sway, right? First X-ray. Okay, stay here. Okay. Okay, step to your left until you touch the ball. Okay, good. Okay, perfect. Okay, whole body move that way a little bit. No. Okay, you need to step like, okay, so here. Okay. Oh, like just look straight. Look straight first. Oh, good. Okay. Okay, this one is AP open mouth, so you need to open mouth. Open mouth, look straight, don't move, okay, don't move. Okay, whole body move that way a little bit. Oh, okay, that's good, okay, that's good. Facing the wall again, this wall. Okay, hand and elbow together. Good, okay, so, okay, good. Okay, step forward a little bit, step to the left until you touch the ball. Okay, good, okay, good. Stay here, don't move, okay, don't move. Okay, step to the left until you touch the ball. Okay, good, okay, good, okay, perfect. Yes, stay here. Okay, good, stay here. Okay, yeah, turn this way. Okay, step back. Okay, until you touch the ball. Okay, good. Okay.
Put the hands up.
Oh, the hand on side is fine. Okay, stay here. Come on. I'm explaining X-ray to you, okay? In this X-ray, like next time you come here, okay, I'm do all this software measure. I'm explain to you for more detail. Okay. But at first, you need to know what's normal first. This is spinal degeneration, okay? Like green color is normal, red color is not normal. Normal, you can see the curve. The curve should be 42 degrees. This is the curve, right? So this is 65 years old. The curve should be like this. All this, okay? The disc should be wide open. Your disc compressed a little bit already. Yeah, C1, C2, C3, C4, C5 compressed. Tell me, any pain here? 4, 5, 5, 6?
No.
It's okay, right? It's okay?
Mm-hmm.
How about now?
It's okay. A little pain.
Little pain? So low.
That's good enough. I feel it.
You feel it?
Yeah.
Oh, good. What is so? Okay. Upper best time. Okay, take deep breath in, inhale, exhale. Okay, one more time, inhale, exhale. Good, okay, one more time, inhale, exhale. Okay, yeah, turn sideways for a little bit, turn sideways.
To the right, left or
Yeah,
right?
yeah, face me, yes.
Okay.
Okay, good. Okay, good, good elbow, okay, good. Let's see what you do. Yeah, it's very tight. The other side.
It's stiff, huh?
Yeah, very tight. Even low back's tight too, so. Okay, so on your back facing up. Okay, scoot aside, up, lift up. Okay, good, stay here, stay here.
Oh, yeah, when I stretch right there,
Uh-huh,
I felt the
you
pain.
feel it, yeah. Just a little bit, okay, relax, okay, let's see if I can do this. Okay, so you feel anything move neck up or back?
I felt it, yeah.
Like which area? Neck?
When it popped, like all of this popped down here.
All this
All
part?
of it, all the way up.
Okay, good. So, okay, so when you get up, like turn body sideways, okay? So how do you get up in the morning? Turn sideways, elbow, hand, push up.
I usually turn on the sideways.
Yeah, turn sideways is good.
Sideways, yeah.
Yeah, okay, just sit up for me. Yeah, take your time. Yeah, turn sideways, I know it's painful. So, push yourself is easier. So, okay. So, okay. So tell me, like, when now, like, how do you feel your hip, like, when you raise your arm up, like, you want? It's a little bit better.
More mobile, yeah.
It's more mobile.
Yeah.
So and then you say like you come in 10 out of 10. What's pain level now?
Right now, I would say it's 6.
6. Yeah. Oh, 6 better. You feel better?
It's better.
Oh, okay.
But the issue with the hip is that when I start to feel the pain is when I'm standing.
Standing.
When I'm over an hour of standing. That's where the pinching starts in the back. Oh. And that's when I have to sit down.
Oh, okay. But so how about you stand up now? Like let's see. Like you stand up. Is it still painful? A little bit better, right?
A little bit better, yeah.
Better. Yeah. So like before you stand up, you barely can stand up.
Yeah, you barely stand up. But yeah, it's a little better.
It's better, right?
Yeah.
So like, how about you, when you walk around? Is it better too?
It feels better. Yeah.
You feel better?
Yeah, it feels better. I can speed up a little, see?
Speed up a little bit.
Yeah.
Okay. Yeah, sure. It's a little bit better. Yeah. It feels better, right?
It's a little better.
A little bit more flexible.
Look.
Or you can reach all like before you cannot, right?
Cannot before. Look, all the way up now.
All the way. Wow, nice. Oh, getting better. Okay. Yeah. Much better, right?
Much better. Yeah. Look.
Yeah, you can reach all the way. Oh, nice. Wow, good. Okay. Oh, okay, good. Before it's very difficult, right?
Before it was like.
Yeah, a belly.
Right there only.
But
look.
Now, all the way up. Oh, nice. Okay, it get much better. Okay.
Much better, yeah.
Okay.